So in principle, indeed, ALL, first, it's most frequent malignant disease in childhood, and it's has an excellent prognosis. However, a few patients, they do relapse, and the ones who relapse, they have a poor prognosis. Some of them need even stem cell transplantation. And if patients are relapsing post-transplantation, then it's even more difficult to treat them. And these are mostly the patients we are treating with CAR T cells.
Yeah.
So I'm a pediatrician, so I would really like to focus on the pediatric field, and indeed the first patients treated successfully have been children, indeed. And this was a product then generated in Philadelphia by Carl June against the CD19 antigen, and this was spectacular in 2012. The first child has been successfully treated, and then this treatment has been taken over by or has engaged finally pharmaceutical industry, and then led to the license of the first product, which is called Kymriah, in Europe and North America. And this was followed by many activities in China as well, and you have a lot of products with excellent capabilities and effectiveness now available to treat patients with CD19 positive ALL, which is a great success. So point is always whether you like to compare this with, let's say, allogenic bone marrow transplantation or total body irradiation, or whether you want to compare this to intensive chemotherapy. In my eyes, CAR T cell therapy is it's one of the less toxic treatment I do know to treat these severely ill patients. And so some of them, they are just inpatient for 2 weeks or 3 weeks, and then they could be discharged and could go back to normal life, which is not the case after allogenic transplantation. Of the risk of relapse, you mean, how to minimize the risk of relapse? It's difficult to say. So, as I mentioned in my presentation, this depends a little bit whether you are talking to treat patients up front, or whether you are talking to treat patients who relapsed after allogenic transplantation. So, because there, the product, if you're using autologous CAR T cells, is different to that of a patient who has a naive T cell repertoire. So, I could imagine that for patients who relapse early after allogenic transplantation, an allogenic CAR T cell product might be helpful.